Welcome to my podcast. Today I'm going to talk about another case. So basically, you have to introduce yourself as we agreed always and double check the patient name and date of birth. So I'll ask the patient, what can I do for you today? The patient will say, for instance, I'm having a blood test result that I would like you to interpret for me or explain what's the finding. So basically, you will say, before going into that, can you tell me why this blood test has been requested? Can you tell me more? So in this situation, you need to take a focused history according to the blood result that you have. So basically, it's about abnormal blood liver test. So you will tell the patient, can you tell me why would this blood test has been requested? So the patient might say that, doctor, I'm feeling unwell, I'm feeling that I'm having tummy pain, I'm having retching all the time. So you will ask, can you tell me when all that has started and is it getting any worse? Can you tell me about the abdominal pain? Can you point your finger where about the pain? Can you tell me the characteristic of the pain, for instance? Does it go anywhere? Is it constant? Is it gradual? Is it abrupt? Is it worsening, for instance? And anything make it better or make it worse? And on a scale from 1 to 10, where would you rate the pain? Where 1 is least or minimum and 10 is maximum pain? And after all of that, you will ask if there is any associated symptom, for instance, if the patient has fever, if the patient notices anything that doesn't seem right or started or linked with the symptom. So that's basically will bring the ideas and the thoughts of the issue. If the patient has any of that, you will ask if there is any nausea, vomiting, and is triggering food, for instance. And you will ask them if there is any other symptom, say for instance, because this is the liver, so I'll ask if there is any change in discoloration, if there is any itching in the skin, if there's any change in the color of the poo and wee, for instance. So all of that you need to ask, and you will ask how's the energy level, and if you feel fatigue or tired, and what's your appetite like, because sometimes patients they have acute hepatitis, they will be like tired, they will lose appetite, they might lose some weight. You will ask if they had any preceding, for instance, flu-like symptom, in order to think about the differential basically around that area. And then you will ask if there is any similar history in the past, if there is any past medical history that you should know of, if there is any medication history, maybe the patient is taking medication for other illness, or he's taking something OTC by himself or by herself, and ask if there is any family history with the same problem in the family, and if there is, of course, any allergy, and if there is anything recently been done, like, for instance, basically in liver, you will think also about if the patient had a major operation, for instance, or if he had received blood transfusion recently. And then you will pass through the lifestyle questions. So basically, you will ask the patient, what's your energy level, what's your activity like, what sort of a job do you do? Do you smoke, for instance? If the patient say, I'm smoking, say for instance, now when we are in the vaping era, so you'll ask what sort of smoking do you do, how frequent, and for how long? Do you have any family who's smoking with you, for instance? Sometimes you find the man and his wife, which might influence the kid in the future as well. And you will ask about drinking habit, because this is very related to any issue related to the liver. And also you will ask if there is any history of drugs intake, whether it's IV or any recreational drug history. And then, of course, in certain community, in certain culture, there's this tattooing thing and piercing thing. So you will ask also about that, because that basically involve a needle insertion and introduction of the pigments. So you'll ask where it has been done, how long ago, and if there is any infection. And because sometimes certain people that are really covered in tattoo and piercing, so that's another issue to be asked. And of course, sometimes you need just to ask about if there is any accidental sharp object injury, like needle, nail, this sort of thing. If the patient is young, and well, I mean, basically, it's a question that you need to ask in all ages, but mostly in young people. So if they are, for instance, sexually active, they have stable partner or multiple partner, if they practice safe sex, and if there's any issue around that area, maybe they have any, for instance, problems, discharge, itching, and if that's according to the situation, you will direct your question just to ask some questions just to get the whole picture about this. And after that, you will tell the patient if there is anything else that might not be asked, or maybe the patient would like to bring it in. And then ask the patient that I would like now to have a quick look and examine you just to know what's going on. And you'll have a chaperone if that's something patient is interested with. So basically, you will examine the observation, which include the blood pressure, temperature, pulse rate, respiratory rate, and then you will examine the tummy and do, of course, superficial palpation, and then deep palpation in the area of the liver, and ask the patient before doing that if there is any pain in the area in order to avoid it, and start far from the pain area and proceed gently until you reach the area. So you feel for the liver, if the liver is enlarged, if the edge can be felt, if there is any tenderness in the right upper quadrant. And then you will explain the blood result according to the finding. So for instance, if the patient says, I'm having like previous upper respiratory tract infection, you might think of viral hepatitis. If the patient is a drinker, for instance, you will ask how frequent do you drink, which days of the week do you drink, and bring their attention that the allowance per week is 14 for both male and female. And then according to, of course, I said, to the finding, you will tell if it's the liver enzyme increased, it means that the liver is injured, and that's why the ALT and AST is raised. If it's the alkaline phosphatase, you'll understand there is element of obstruction, and then you will ask the patient that, basically, there is 3 viruses which could affect and cause raised liver enzyme. So it's hepatitis B or C and A, and other kinds, which is like E, which is trivial and can be, A and E can be related to orophycal, and B and C, it's basically blood transfusion. So you will ask, even if the patient, for instance, is working, you will ask what sort of work do you do, if you're taking any, as I say, like sharing drugs through needles, tattoo, as I say, because sometimes they use the same needles, so there is no element of hygiene. And then if there is this one, the IgM and the IgG. So if IgM is positive or raised, because usually it's raising in the first 2 weeks, so that means the patient has acute infection. If If it's IgG, it means the patient has a previous infection, and this will stay forever. It will stay permanently. It won't go away, which means that the patient has a previous infection with that. And then you will tell the patient you need to have some rest, for instance. Don't burden your liver, so try to eat small, light meals. And also, if the alkaline phosphatase was raised, for instance, and when you examine the patient, if you do Murphy sign, if the patient felt pain while they are taking deep inhalation, and if the pain is referred to the right shoulder, so that coincide with gallbladder. However, according to the finding, as I say, you just need to think about the differential. If the sclera and the skin looks like slightly yellowish, so that's another issue as well. So in both cases, you will think that we need to assess if the liver is functioning well and what might be the cause for that. So basically, according to the blood result that you have, you might arrange for ultrasound just to double check that there is no gallbladder stones, and you will check with that as well if the liver is enlarged, and you take it from there. So if it was viral hepatitis, you'll explain to the patient that it's an element of self-limiting condition. It will go in its own way, so the patient might feel sick, may feel nauseating, vomiting. So as I mentioned, just eat small, lighter meals, not richy or spicy food, and give them, for instance, metoclopramide or any of anti-sickness medication if it's needed. If there is, of course, element of liver issue, so you will refrain from giving paracetamol in order not to strain the liver because it's already strained. Ask the patient, of course, if the patient is a drinker, so tell them that you need to stop alcohol until your liver improves, and get a lot of rest, and try, like for instance, in certain men, they have protruded tummy, and some they like to wear sometimes, tight tops. So you can tell them that you need to wear a loose cloth in order not to press on the tummy, and take it easy in order until you feel better about yourself. And also, before finishing that, if you have any suspicion about, for instance, hepatocellular carcinoma, because those patients who are heavy drinker might, with time, go into a phase of cirrhosis, and then it might change to, of course, later stage hepatocellular carcinoma. So you need to ask while you're taking the history if there is bumps and lumps, if there is any history of a recent weight loss, and of course always never to forget asking the patient if they have any thoughts or idea what might be going on. And according to that, you will just assess the case. And after giving all of those instructions, you will tell the patient about the safety netting. So if there is anything that doesn't seem right, or you feel that you're not improving or not feeling well in yourself, please come back again or go immediately to the A&E. So by that, I hope that I covered the main issue around abnormal liver blood test finding. Thank you.